Dr. Joaquin Berron from Dentaris Dental Center in Cancun, Mexico, discusses some of the top dental procedures, including immediate load and traditional implants, as well as the highlights of his clinic.
My name is Dr. Joaquin Berron. I'm the head clinician for the Dentaris Dental Clinic in Cancun, Mexico. I did my pre-grad in Mexico City at the Intercontinental University, and then I did my post-grad at the Universidad Tecnológica de México in Mexico City too. My program was like a GPR, it's the equivalent of the GPR in the United States as a general practice residency. Only that in the US is a 1-year program, in Mexico is a 2-year program. And you basically go through most of the specialties again, but in depth. So surgical, prosthetic, endodontic, and periodontic. Those are the basics. Mine was very focused on the prosthetic portion. And there we started already doing implants. This is back in 1991. So implants were just starting in Mexico, and we did some of the first surgeries of implants, and that's when I got involved into the implant surgical portion. And then I was working for 15 years, almost 16 years, when I finished my postgrad in private practice, and of course always having continuous education, going to programs and developing more of my surgical skills. And then I went for a program at LSU, Louisiana State University in New Orleans, in the United States, where I did first a 1-year implant and aesthetic fellowship, it's called. And then after that, my chairman at that time asked me to stay and coordinate the program. So I had 2 fellows under me and all the prosthetic residents. And basically what I taught them was, for my fellows, I would do a lot of surgical training with them because they were already prosthodontists. This is a program that's created for prosthodontists to get more skilled in surgery because it's a perfect marriage. Surgery and prosthetics need to go together. The program, like I said, is more to develop the surgical training of the prosthodontist, and then for the pros residents, I would oversee the prosthetic parts that they were doing more than anything. So this, instead of being a 1-year program, it ended up being the 5-year thing that I stayed there. And it was a very humbling experience to teach at that degree, because you're with all the people that write the books and doing surgery and doing all these cases with them. Very interesting, a very, very satisfying experience. So as far as accreditations, like I say, it's the ADA, American Dental Association, ICOI, American Academy of Implant Dentistry, and the Ateneo Odontológico Mexicano. And the clinic has won 2 years in a row the first prize for Mexico for the global review. And this basically what it is you have to present the paperwork of your clinic, meaning, for example, the sterilization methods that you have, the surgical protocols that you take care of, the type of products that you use within the clinic, and this all sums to, and they will give you a ranking. And we've been ranked the top clinic in Mexico for 2 years in a row with them. This is an independent institution that does that, so it's a very important thing for us. The main procedures that we do here is, in the prosthetic area, we do a lot of smile makeovers. And that means basically patients that have worn their dentition out or that they want just aesthetic improvements in their smile. We do this full mouth renewal, meaning either with veneers or crowns, and we change completely the appearance of the patients, the smile. That enhances their confidence a lot, their self-esteem, and that's one of the main things that we do, because patients that come to us, usually they don't come for minor procedures. So this is one of the big ones that we do. The other thing that we do a lot of are implants nowadays. Implants have become a major part of our practice because in the past, without implants, we didn't have the ability to restore a fixed dentition on a completely edentulous patient. Nowadays with implants we can do that, and we do that all the time. Be it with the all-in-4, all-in-6 protocol, it depends what the patient's needs are and what the patient's conditions are when they come to us. In order to do this, we always go through an intensive study of and diagnosis of the patients, We do, for implants, we always do a CT scan, computer tomography. This gives us the third dimension, and we can do cuts of the areas where we want the implants so that we can measure the width, the height of the bone, the quality of the bone, and all of this is part of this diagnosis that is so important so that you can have a correct outcome. Those are the two major ones. Then in implants we do a lot of single implants. Nowadays when you lose a tooth or you lose be it anterior or posterior, it doesn't matter. In the past, the only way to restore a tooth like this was either a fixed bridge or a removable partial. Nowadays, implants gives us the ability to restore that tooth again without damaging the two adjacent teeth, if you're thinking of a fixed prosthesis, or being with the hassle of removing a removable partial, and some patients have that they have to remove, clean, put it back on. Sometimes they're not so stable. So that is a great advantage nowadays with implants. Those are the main things that we do. Of course, we do all the operative and endodontics and all the things that go around these main things. Because if you're doing a full mouth restoration with implants and crowns, you might need root canals or endodontics, some perio treatment, but that all goes around the main treatment that would be a full mouth restoration, for example. So all of our treatment plans, when we're doing prosthetic parts, we need to have a lab. We have a master ceramist that works with us. This means that his skills on ceramics and aesthetics are far superior than the regular lab. We do all these aesthetic cases with him, and now we have involved all the computer, the CT parts in the lab, meaning that, for example, when we do full mouths, we can do completely monolithic zirconium crowns that then they are painted by the ceramist, and that means that everything is milled. We scan the cast that we take for the patients, and from a former wax up that we create so that we can express or we can show the patient where would be our end result before we do anything else. We show this to the patient. If the patient is happy with that, then we prep everything, we take impressions. All of this is scanned in a desktop scanner, and then this is put into a software of a computer where we can overimpose images. So we scan the model that's prepped, we scan the model that's waxed up, and we merge both things. That way the computer will have exactly the type of teeth that we want to create for this patient, and the patient has seen this in their mouth with the mock-up that we previously do. That way the communication between patient, lab, and us is perfect. You have to have this when you're doing cases like this, because if not, something that can be aesthetic for me might not be aesthetic for you, because aesthetics is completely subjective. So it's important to have this communication first between the dentist and the patient, and then translate this information to the technician. And that's the way we do this full mouth rehabilitations all the time. And most of the time, all the time, basically, we have excellent results because the patient already knows what they're going to get at the end result before we start the case. And working closely with our lab, we can do that, we can create that. For the implant parts, everything again is scanned, because the accuracy of milling the parts for implants is much higher than in the past, that when we had to create it from the lost wax technique. Nowadays, everything is milled, so the fit is perfect, and that's very important. You have to have a passive fit when you're doing the full arch for the all-on-4 or the all-on-6. The seating of the prosthesis must be passive, always, because if not, you start straining the implants. And all this we can create because we have that excellent lab that we work with. My hometown now is Cancun, of course, and the great thing about Cancun is that the infrastructure that we have, being a touristy place, is great. We have great connections, talking about flights. You have direct flights from most of the major cities in the US. You have great hotels, so extensive variety to choose from. funny enough, it's one of the safest places in Mexico. I know that Mexico sometimes has not such a good reputation about safety, but in Cancun, you will never hear something going wrong with any of our tourists, because we take care of them very much, because that's what the destiny is from, right? Of course, the beauty of Cancun, the beaches, the parks that we have, is something that you should experience. The Caribbean is just something beautiful. So about immediately loading implants, this is a technique that statistically in the literature, they have the same success as delayed load implants. When do we do immediate loading? So most of the time, if we're doing a full arch, and you're placing 4 to 6 implants or 8 implants depending, most of the time you can do an immediate load. And the benefit of this is great, because a lot of patients have still some remaining dentition when they come. And of course, if you're going to give them a set of regular dentures, they're going to be miserable for a while, because getting used to something removable is not easy. So in most of these cases, what we do is we extract the teeth, we place the implants, and we attach the prosthesis to those implants in the same appointment. This, of course, is a temporary prosthesis. And this prosthesis will be changed in 4 to 6 months after that procedure is done. But part of the advantages of this is that the patient walks out of here with a fixed set of teeth. They have to be careful though. For the first couple of weeks, they're going to be on a completely liquid diet and then on a semi-soft diet for another 6 weeks. This is the protocol we need to follow to ensure that we won't be jeopardizing those implants. And then after that, they go back to regular life with a regular chewing and everything. And then, like I said, 4 to 6 months after that, they come back. So it's a 2-trip thing. And then we can change the prosthesis for a final prosthesis. What is the difference between the temporary prosthesis and the final one? The temporary prosthesis is made out of acrylic completely, because we have to create it at the time of surgery. When we do the final prosthesis, this final prosthesis have a metal substructure that's folded into the implants, and then it's wrapped up either in could be porcelain or acrylic and denture teeth. Either or, depending on the case too, again, and depending on what the patient wants. And for single implants, for example, in the anterior segment, we always do immediate loading when it's possible. But we need to assess and make sure that the patient is a candidate for that with a CT scan. If the patient is a candidate, the best way to preserve those tissues is to do an immediate load, because once you place the implant at the time of the extraction, you will create a temporary that will have the form of the tooth. And this will help to preserve the tissues, both the bony and the soft tissue, in a perfect way. That will enhance the aesthetics, of course, of this restoration. That in the anterior segment is something that's indispensable. You have to have the aesthetics. Some patients have a low smile line and they won't show it, but still, you want to have something that's matching all the natural teeth, and that is the way to do it. And again, this type of loading in single implants, we will do that temporary, that will be made out of acrylic again. And a few months later, 4 to 6 months later, we will change that for a porcelain crown. So about the guarantee in our treatments, for example, in the implant area, if there's a 98 to 96% of implant success. If by any chance we've had cases that have gone into that 2 to 4% of non-success, what we do is, at no charge, if we need to graft, we'll graft, and then we'll place another implant, or we can just replace the implant, we'll replace the implant, depending what the case shows. But we would do that at no cost for the patient if we need to redo an implant if it fails. And of course, this is within the first few months. After X amount of years, then it becomes a shared thing, because of course, once an implant is functioning as well, the patient needs to take care of it too. Well, there's that 2 to 4% of implants that are idiopatically failing, meaning that we don't know exactly why. There have been cases where we have placed 2 implants, one beside the other, one is perfect, the other one doesn't take. We redo that implant and it takes after that. So in the literature, there's not really anything that shows exactly what is the cause of these implants to fail. But the important thing is to follow every time the protocols that you need to follow. slow drilling, a lot of irrigation not to warm up the bone, right positioning of the implant, right loading of the implant. So as long as you do those steps, you will have very little problems. Dentistry for me is a family thing. My dad's a dentist, my great uncle was a dentist. And funny enough, when I started dentistry, I was fond of it. But then when you get to a postgrad and you find the area of dentistry that really interests you, it just becomes like a hobby. For me, working with patients, number one is so rewarding, because especially the big cases that you do, when you change the patient's smile, like I said, you can change their personality, you change their lifestyle, you change their self-esteem. And that is so rewarding. I don't think there's any other profession that gives you that much reward when you see a patient smile first time with all their new smile. And a lot of patients even cry of happiness, and that is something that is just makes you want to do more. Makes you want to give the patients what they need, what they want, and what they're looking for. And for me, like I said, it has become a hobby that coming in here is always interesting, it's always new, it's always a new case where you can help someone, and that's great.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.